The operation that's considered the gold standard for stapling procedures and the most common done is the gastric bypass. A gastric bypass is an operation where we make the stomach look like a golf ball by cutting out a small piece and then bypass the bottom part of the stomach and the first portion of the intestine. What we've seen with our 15-year history of gastric bypass is that this operation really works extremely well for the first year. However, after the second and third year, we're seeing an increasing amount of recidivism. Now, part of the reason is we have thousands and thousands of post-gastric bypass patients, and the majority are probably doing extremely well. But one of the things that we're concerned with is that patients develop a rapid emptying. As a result, we've been going back on a number of patients and providing revisional procedures such as banding over the bypass. It has also allowed us to really train our current gastric bypass patients on several principles. Some doctors say gastric bypasses are the operation of choice for sweet eaters, because if you eat sweets, you'll get a dumping syndrome. We believe that's hogwash. We believe that if you eat frequent sweets, you're not going to do well with any operation, and a gastric bypass may even encourage you to eat more, because what happens is your sugar goes down when you eat the sweets and goes up when you first eat sweets, then you get an insulin reaction and the sugar goes down precipitously, and that makes you very hungry. And what do? You eat again. And so one of the things that we really teach is a low glycemic or a low sugar diet in our bypass patients. We also teach our bypass patients not to go long periods without food, because we don't want to see the abrupt low levels in sugar levels. We also teach them to thicken their foods, to eat things that are extremely thick, and even use supplements like gelatinous protein or things called thicket to thicken their food so food stays in their pouch. With these modifications, we can get our gastric bypass patients to lose about 70% of their excess weight, and we hope minimize any relapse or recidivism.